Each year, it is estimated that more than 50,000 infants inherit sickle cell disease, and more than 200,000 infants inherit the sickle cell trait. These infants inherit the allele in which the nonpolar amino acid valine is coded for rather than the acidic amino acid glutamic acid. This changes the shape of the protein because of the difference in the nature of these amino acids. And since red blood cells possess 250 million molecules of hemoglobin, changing the shape of beta hemoglobin thus can alter the shape of the cell, causing it to sickle and to become more rigid and less flexible. The sickling of cells is most pronounced when partial pressure of oxygen falls beneath 40 to 45 millimeters of mercury, and so thus altitude, physical exertion, and disease can have a role in causing the sickling of these cells. This rigid sickle cell form causes a number of complications, such as the blockage of blood vessels, vasoocclusion, and can also result in chronic anemia, hemolysis, pulmonary hypertension, and a number of other problems. Infants with sickle cell disease may suffer a stroke in the first few weeks of life. Up to 10% of them can. Blood vessels in the spleen are especially vulnerable to this vasoocclusion, so thus splenic congestion and then even asplenia are common complications in children with sickle cell disease.